Hello everyone, welcome back to my channel Answers Simplified. In this video, I will be sharing answers of Viva Class 7 Social Science, Civics Chapter 3 Role of Government in Healthcare. Let us discuss the long answer type questions. First question, why has the public healthcare system failed to make India a disease-free country? Answer, our public healthcare system has failed to make India a disease-free country because India spends only less than 2% of its GDP on healthcare. By comparison, China spent 6.7% of its GDP on health, and in the UK that figure was 10.2%. Every year, life-threatening diseases like TB, cancer and malaria affect lakhs of people in India. Waterborne diseases like dysentery, jaundice, hepatitis and diarrhea make up around 21% of all communicable diseases. We are still unable to provide a clean environment and drinking water to people. Despite substantial improvement in the health and well-being of the country since independence, undernourishment and malnutrition is an ever-present danger to the children of our country. Almost half of all children under the age of 3 are underweight, and more than half of the women and children are anemic. Many programs and schemes have been launched to deal with the problems of the undernourishment of children. Question 2. Differentiate between public and private healthcare systems. Answer. The public healthcare system consists of state-owned healthcare facilities which are funded and controlled by the Government of India. The Ministry of Health and Family Welfare is a central government body responsible for forming health policies and improving public health. As such, villages, towns and cities in India have a network of the public healthcare system. Under the public healthcare system, the government tries to create awareness about health to eradicate diseases and other health problems. Special care is taken for the economically weaker section and vulnerable parties. Private healthcare is the medical facility provided to the people by private entities. India's private healthcare costs are among the lowest in the world. However, they are still out of the reach of a vast majority of its citizens. According to World Bank data, 99% of India's population cannot afford private healthcare services. However, each year many of our own citizens are pushed into poverty because of payments made for healthcare. Despite checks by the government, the facilities, services and medicines available in private healthcare institutions remain very expensive and beyond the reach of the common people. Question 3. Discuss the health-related problems faced by the citizens of India. Answer. Large sections of our society do not have access to medical care. This may be due to lack of adequate medical facilities, too much distance from the facilities, inadequate transport to the facilities, absence of competent medical professionals in the area. Every year, life-threatening diseases like TB, cancer and malaria affect lakhs of people in India. Waterborne diseases like dysentery, jaundice, hepatitis and diarrhea make up around 21% of all communicable diseases. We are still unable to provide a clean environment and drinking water to people. Undernourishment and malnutrition are an ever-present danger to the children of our country. Almost half of all children under the age of 3 are underweight, and more than half of the women and children are anemic. Question 4. What guidelines have been mentioned in the directive principles of state policy related to healthcare? How do they ensure access of all the resources to all communities? Answer. In the field of healthcare, the directive principles of state policy ensure that citizens get adequate means of livelihood, equal pay for equal work is given, sick, aged, unemployed and disabled get work, education and public assistance, maternity relief is given to working women, the level of nutrition and standard of living conditions is raised and public health is improved. To ensure the availability of resources, the public health expenditure in a state is shared by the central and state government. All state governments are responsible for the public health of their state. The Ministry of Health and Family Welfare sets policies for the states to provide and improve health education and service. Essential medicines and equipment are provided by the state government. Medicines are made available to people for free or at a low cost.